Welcome back to Living 808. Medical science has really advanced the way we think about cancer these days. There are new approaches to detection and treatment, and patients are better educated and prepared than ever before. Now, one area that's received a lot of attention is nutrition, especially during cancer treatment. Dr. Christina Spears, a radiation oncologist with the Cancer Center of Hawaii, joins us to talk more about that. Hello, thanks for joining us.
Thank you for having me.
So, nutrition,
Yes.
Why is that important, especially during cancer treatment?
Well, more and more we're aware that our environment has a huge effect on how we respond to triggers like stress or disease, and cancer is no different from that. So we now know that you can really supplement your healing, supplement your effects from cancer treatment by giving your body good nutrition. So I have patients coming in and out of my office all the time, and they ask me, what's the best cancer diet? And they have a number of lists that they've gotten from the internet, and they're trying to parse these lists, and it can be very confusing. And so I can understand the confusion surrounding that, but understand the wish to make your health better, not only through cancer treatment, but also through healing, through food.
So what is a good diet to follow during cancer treatment?
I think in general, the normal recommendations for, eating more plants and having a plant-based diet, reducing your red meat intake, increasing your water intake, all of those hold with cancer treatment. But I do tell patients that the most important thing during radiation treatment is to keep your weight stable, especially since as you go through treatment with chemotherapy or radiation, not only is your appetite affected, but your ability to eat and sometimes even your metabolism is affected. So sometimes you have to eat more in order to keep your weight the same.
Mm-hmm. That's a good point. I have a family member who had breast cancer and went on a special, very, very healthy diet.
Yes.
She did lose weight, but she looked great.
Yes.
And she's actually, now that she's in remission, has stuck to that very healthy diet. So if it wasn't for that, she just became a lot more aware of how it was affecting her body.
Oh, absolutely. That can be, there's few upsides to being diagnosed with cancer, but it does make you aware of your body and the ways in which we should honor our body and what it's telling us it needs. Sometimes patients come and they want to go on a very drastically different diet. And while I applaud their wish and their need to be healthy, I do tell them, moderation is key, because drastically fluctuating your diet and decreasing your caloric input can be another stressor on your body that makes your side effects from radiation even tougher. So, it always comes down to honoring your body and what it needs and what it wants.
Yeah, that's a good point, because already with being diagnosed with cancer, you're already going through so much. So to add something else, that may not be easy, that may affect your body in an adverse way. So do you typically recommend then that people change their diet? How do you handle that?
Most often not. We'll have a discussion with what a healthy diet is, what they're craving at that moment, what they even can tolerate, and I start from there. If a patient has poor appetite and the few things that they're eating, the few things that are giving them any calories, are things that are not so healthy, I won't take that away from them. I think it's important to make patients feel supported, and for some patients, food is a really important part of that. Yeah. So I tell them, let's try to take a long-range view, let's try to keep your weight as stable as possible during treatment, and then we'll talk about health and nutrition when that is appropriate.
All right. Thank you so much.
You're
Again,
very welcome.
very important. And like you said, there's so much information online.
Yes.
But you really want to talk to your doctor. There's a lot of misinformation as well.
There is, and what works for someone else may not work for you. So
yeah, that's true. Thank you. We are going to have much more on Living 808 when we come back. Stay with us.